Do you suggest getting blood work done before starting supplements?
I generally get blood work when I see the first time because I'm a scientist and I need all the data. So when I see a patient first time in my clinic, I do following thing as a routine. I mean, maybe little modification here and there, but I try to get that. Number one, they will go and get blood work. They will get CBC, they'll get serum iron, they will get complete chemistry, they will get vitamin D for sure because it's very common in my experience. Okay, these are the routine. I always get T3, T4, TSH, the thyroid level. And thyroid is very important. I'll give one example to illustrate. I had a patient from Katrina. You know, we have storms coming, and we had Katrina, big storm, which destroyed billions of dollars property. And that dispersed many people from New Orleans, and they came to Houston and Texas. One of them was this patient. She was 6-year-old, diagnosed as autism, and they heard my name through different sources. And they were in Houston at that time. They traveled to Austin to see me, to see how I can help this patient with autism. Routinely, I got the blood work, and her blood work included thyroid function test. And guess what? Her thyroid function was abnormal, it was low. And her diagnosis was hypothyroidism. She was 6-year-old. And somebody did not do that thyroid function study when she was 1-year-old, 6-month-old, or whatever time. And after 6 years, you don't improve a whole lot. She went on thyroid, medications. She improved, but I could not improve because the brain damage has already happened. So make sure that this blood work, some way or the other, help you in managing these children. So all those blood works are very important. I do not do vitamin levels. I do not do omega-3 levels. I have done it as a part of my research, but I found it was not conclusive. Mm-hmm. I also do not do any hair kind of analysis or cuticle kind of analysis. There is a lot of crazy stuff goes on in autism population. Mm-hmm. And they have not been helpful at all. So as a parent, I want you to be very careful. We didn't talk about chelation therapy and all the stuff and all. I've been through it. Maybe I'll take part B lecture one day and do a different one for you all.
Yes.
Those blood works are very important. Okay, and then I do EEG almost for all patients because we are neurologists. We want to know the brain. I don't do MRI scans for all patients, but if I suspect there is a problem, then I do MRI scan. The problem is I have to anesthetize them to get them to sedate, and that is a high risk kind of thing. So we don't do that. Okay. I get psychological developmental testing. We do ADHD testing if they're older. And one of the tests that we are doing through Pod Health, which I think India should use that, and that is CREOS. And CREOS is a very good test. It's done online, and you'll get an idea what's going on. So these kind of things are very important. So those are my routine things I do.